Good afternoon. Welcome to day 331 at the EMA office where we're bringing you the latest in the COVID numbers and some information on vaccine and a lot of questions, and we'll try to have some answers for him. Chairman Kern is with us today and Mila Blankford from the Health Department. And it's we're going to call it the Mila Show today.
Wonderful.
You got all the questions.
Okay. So for today, Sunday, February the 7th, we have 89 new positive cases out of a total of 1,411 tests for today. The age range of these individuals was under 1 to in their 80s. The county positivity rate is at 6.3%, with the regional as of 5.6% as of February the 4th. Our 7-day rolling average is 7.2%, and we're happy to report we have 0 new deaths for today. Countywide, we've conducted a total of 264,863 tests, consisting of 26,735 positives and 128 negatives. Total number of deaths to date is 425, and our condolences go out to those families. To date, the number of individuals who have completed their 10-day isolation period is at 25,293. Statewide, we've conducted a total of 16,636,585 tests. Total positive number is 1,146,341, which is an increase of 2,060 from yesterday. Total deaths of the state is 425. That's an increase of 48 from yesterday. St. Clair County hospitalization numbers, we have 88 COVID-related hospitalized patients within the county, and regionally we're at 145. Patients on ventilators is 6 in the county, and regionally we're at 8. For congregate care, for those in outbreak status, we have no new additions for today. And with regard to testing, on Tuesday, February the 9th, we'll be with IDPH at the Depot Firehouse from 8 to 4. On February the 16th, we'll be at Caseyville Village Hall, again with IDPH from 8 to 4 o'clock. Okay, Chairman Kern?
Great. Thank you, Mila. We'll go to the zip code report. In 62201, we're up 1 today to 552. 62206, up 3 to 1,224. 62207, up 2 to 551. 62208, up 4 to 1,488. 62220, up 6 to 1,900 today. 62221, up 14 to 2,568. 62223, up 3 to 1,597. 62226, up 10 to 2,947. 62243, up 1 to 694. 62254, up 2 to 752. 62255, up 1 to 75. 62258, up 6 to 963. 62260, up 2 to 739. 62264, up 2 to 337. 62269, up 15 today to 3,023. 62282, up 1 to 61. And 62285, up 2 to 520. As Mila said, 89 new COVID positives in the county today. 1,411 people tested brings our county positivity down to 6.3%, which then brings our rolling average down to 7.2%. Regional positivity today is also down to 5.6%, derived by Bond County coming in at 1.8%. Clinton, 1.6, Madison, 6.2, Monroe, 10% today, Randolph, 0.6%, St. Clair, 5.3%, and Washington County, 4.1%. All those numbers headed in the right direction, and Mila's got a lot of questions today, Herb.
A lot of questions, so we're going to get at them. Brian, you got the questions for Mila.
Okay, Mila, first question in today says, why are people deemed essential in 1B being turned away because they aren't 65? I had an appointment, I'm essential in 1B, but was deemed not able to get it because I'm not yet 65.
Right. So everyone is deserving of vaccine, and we would gladly provide it to everyone should we have enough vaccine for everyone in the county. But because we don't, we've prioritized that 1B population. So we're looking at vaccinating those that are 65 and above. And the reasoning behind that is because those are the most medically fragile, as well as what we've seen in the highest mortality rates. So in order to keep the community safe, we've prioritized those populations. In addition, 1A, frontline healthcare providers, they're also still eligible for vaccine.
Okay. The next person says, if I was vaccinated at the fairgrounds, how will I be notified to schedule my second dose?
Okay. So, and this goes for any time you receive a first dose, you should talk to your provider, the person who provided it, and find out how you'll be notified for your second dose. So for the fairgrounds, that's our CDP system. That system will send an email or text message when it's time for your second dose, should we have vaccine available at that time.
So then they will get, similar to what they did in the first one, the system will send them a code and they will go in and sign up for an appointment time to get that second dose.
That's correct. And for those that don't have the technology, that may have signed up through the online call center, we'll be reaching back out to those individuals when they become eligible for vaccine and as we have it available. So it doesn't hurt to get it past that 21 or 28-day window. You just can't receive it prior to that time.
Okay. The next person says, do you have any plans to host a teacher vaccination clinic like the ones other counties have planned?
So as we receive more vaccine in the county, we do plan to extend out to those other 1B priority groups. So we could maybe do an evening clinic or a day clinic for specific groups of people based on what we have available in the county. But again, everything goes back to the amount that we receive.
Okay. The next person says, how long is the vaccine effective? Will boosters be needed? And if so, will you have to get a blood test to make sure you're protected?
At the present time, we don't know what the vaccine will look like in the population as we move forward. Similar to the flu vaccine, we anticipate there may be a booster, an additional shot required, but we won't know, until we see that moving forward, what happens and how it varies by the different vaccines that are out there. So I would say keep watching CDC's website. They've got a lot of good information out there about that particular situation.
Okay. The next person says, do you coordinate the list with Walgreens and the area hospitals? It seems like people of any age can get an appointment if they get on the website and schedule at the right time.
So in St. Clair County, we have the Health and Medical Alliance, which is comprised of Eastside Health District, obviously the County Health Department, St. Elizabeth's Memorial and Touche, and Southern Illinois Healthcare Foundation. And for everybody who signs up on our vaccine alert notification form, we then send that list out to the providers as they say they have available appointments. And then they contact you directly to schedule that appointment. So Walgreens is a different entity. They've received vaccine through a federal allocation. So you would have to see them as far as their appointment times and availability. But my understanding is there's not a lot of appointments available from that entity.
So this person's question kind of leads to the fact of that any person could sign up, and we discussed that a little bit yesterday on the briefing, but when a person gets the notification from the health department that they're now eligible, they shouldn't forward that on to anybody else, correct?
That's correct. So within our county, and those of us in the Health and Medical Alliance, we've set the priority groups again at 65 and above and 1A frontline healthcare providers. So we are sending out links to sign up for appointments based on that information. It's come to our attention that people are then forwarding the links, and in our email it says, please do not forward. You are the intended recipient of this email. They are forwarding it. They're changing the text in the email. And then when people come out, when they're asked for their credentials, whether it be a driver's license or something with their date of birth or their medical license, they can't produce that. And then they're turned away for services. So it's not a good situation for the person who comes out there. It's not a good situation for the others who are waiting in line. And then if we've already allocated that vaccine and drawn up based on the appointments that we have, it causes problems to make sure that all that vaccine is used for the intended group.
Okay. The next person said, my 65-year-old parents registered online on day one of the notification sign up being posted. Recently, I read that people who called the call center were getting an appointment sometimes the next day. Are people calling in getting priority over those that registered online? If I call, will my parents get an appointment?
So the intent of the call center was to help individuals who maybe did not have email or any technology to sign up to be put on our vaccine alert notification list. Now, when we were working with the 75-plus population this last week, not everybody was able to complete that process. So they did help some individuals sign up, but that was specifically for that group. And then as we had the situation where people were signing up not in the priority groups, if we had vaccine we had to use in a short amount of time, we might have had them reach out to a few of those individuals. But that would not be a recommended way to try to receive vaccine. That was for specific situations.
And we had talked about this, I believe, yesterday on the briefing. Those 75 and above have all received notification from our system. So if you're 75 above and did not receive that notification, you should re-register so we make sure we get you on the list, correct?
If you have not been on recently, so every day we have more people sign up on our list. So we may have had an extra 200 in the 75 plus that signed up today or the day before. But if you think you've signed up 2 or 3 weeks ago, yes, we have already sent notifications to that group, so you'd want to re-sign up. If it's been within the last day or two, no, you're still on our list.
So once we announced that we were moving to the 65, if you hadn't received it by that time.
Correct.
Last week, then you should be.
Right, we had gone through our entire list at that point, and we were seeing that we had open appointments. So again, why we were pulling back from those individuals who didn't have the technology.
So if we have 75-year-olds out there who have not received calls, we've seen there's been mistakes, wrong emails was documented that they submitted. So if they haven't received information by now, they need to go back in there and sign up.
Right.
Okay.
Okay. The next person says, first off, thank you for all of that you have dedicated this year to keep us informed and keep us safe. I'd like to know if college kids with asthma issues will be vaccinated in the 1C category. He is signed up on your site for the interest. Thank you for doing a remarkable job.
Well, thank you for that. And 1C would be the correct category. Now, we are expecting an updated 6.0 version document from the state that depicts and breaks down the categories. But as of right now, that 1C group would be your priority group.
Okay. The next person says, are members of our military part of a 1A or 1B rollout giving their essential functions?
So the military installations did receive their own vaccine supply. If for whatever reason you're not included in that, you can sign up on our vaccine notification form, and then we will address you as your priority group comes up based on the information that you provide.
Okay. This person says, what can we do if we are due for our second dose and we were not notified of a date and location of our second shot by our initial provider?
Okay. Again, when you receive the first dose, you need to ask your provider or the person who's giving you the first dose how you'll receive the second one. If it was within the health department, as we come up on the date of the second dose, our CDP system will send you an alert for that information if we have vaccine available. But you want to go back to the individuals who gave you the first dose.
And Mila, if they had their first shot, what is the window to get the second shot? Is there a window?
Right, so the 21 or 28 days, depending on which vaccine that you received. And when you received that first dose, you received a vaccination card. It's a CDC vaccination card that says the date of your first dose and then how long you need to come back. So again, that provider that you received your first dose should be the one that you're going to schedule your second dose. It doesn't have to be, but they should have that in your allocation, and they should be alerting you as that vaccine becomes available for the second dose. Now, we see situations where people maybe have received a first dose in Florida or another state. They're coming in and they're signing up on our alert notification form, but that may be also where you want to call into our call center line so that we can document that and see how we can get you in for the second dose. And like I said before, it doesn't matter if it's a little bit after that, but you don't want to take it shorter than either the 21 or the 28 days. Okay?
Okay. Now, the next person says, is there any way someone outside of your allowed groups can get a vaccine from extra supply that is being wasted at the end of a day?
Okay. So as I said before, we turned away 353 people yesterday who did not meet criteria. So, and then in addition to that, we do have appointment no-shows. We've noticed through our first week at the fairgrounds, we've seen certain trends. We know that the evening appointments typically are more no-show than the morning appointments. So there have been a couple instances where at the end of the day, we've had doses that weren't used kind of at the last minute. So we do contact people and say, you may have 15 minutes to get here. And we start with the group that we're in, and then we go out to the 1B, and so on and so forth. But the goal is to not waste any vaccine. So we will give it in order to not waste it.
And throughout the day, you mentioned those 353. So yesterday, throughout the day, I know your staff was working hard. As there were cancellations throughout the day,
Right.
They were working to fill those with people in the eligible age group. So
Right.
it wasn't at the end of the night, there was 353 doses
No.
that had to be.
No, and like I said, we vaccinated over 5,000 people this week at the fairgrounds. We've learned as we've gone, Monday, Tuesday was Moderna. Wednesday through Saturday was Pfizer. Pfizer requires a lot more consideration throughout the day. So we've adjusted the way we draw and our timing so that we don't have any extra doses. And we now have a station of nurses that are doing scheduling right next to our pharmacy. So they watch the line to see cancellations. They watch to see how many people are in queue when people have not showed up for their appointment. And they take all that in consideration when they decide when to draw that vaccine so that we minimize any waste throughout the end of the day. So that we're not in that position.
And then at the end of the night,
Yeah.
you don't leave until every
Every dose is
every
given.
dose that's been drawn is in the arm of a resident.
And that's correct. Now, I will say, if you're over an hour late for your appointment, we're then canceling that and then putting it back out there. So if you do have the link to register, you can go back and look for open appointments. Because as cancellations come in, we put those appointments back on there so people can come in and sign up.
Okay.
Okay?
The next person says, why doesn't the state create a point system where your age plus points for various health conditions and additional points for various occupations, and then have all the vaccine distributors work off the same system and take it in highest point order? It seems more straightforward and fair.
Well, you could present that to IDPH, but they do work on recommendations from CDC and other federal level groups in order to determine what their prioritization is. And then they give those updates through our mass vaccination plan, the state plan. So they just released 5.0 and the 6.0 is coming out in short order, I do believe.
Okay. Next person says, my wife and I are both over 70. We registered at the same time, but if one of us gets the appointment notification, can we both be vaccinated for that notification?
No, you would both have to have an appointment in order to receive vaccine. And the reason it's like that is because in our scheduling system, it pulls from our inventory by lot number. So you are assigned basically a dose by the lot number to the individual who has signed up. So we can't add or subtract as we go through the day. As cancellations become available, we put that out there for people to sign back up for those slots. But they are assigned specific lot numbers when we make an appointment.
So if you are a husband and wife, you need to make both appointments at the same time
That's
when you're
correct.
making that first appointment to guarantee something like that could happen.
Right. And for those of you who've not been out to our site yet, when you come in through the gates, you're directed to a checkpoint A, and they check for your appointment information. So you either have a QR code that you have on your phone or that you've printed at home to bring, and it says your appointment date and time. Now, we also keep a listing there of individuals in case there was a cancellation in addition, to make sure that we've got everybody who's actually registered for appointments. They know that at checkpoint A, and that's where they'll verify your credentials as far as, your age, if you have a medical license, before you're permitted to go on then into the system, where they start looking at your consent forms and your medical information prior to vaccination.
Okay. The next person says, I've signed up for any site I feel I qualify for. If I accidentally sign up for the same site twice, what happens?
I would advise you to go the first one who calls you for an appointment.
Okay. Next person says, are Illinois residents from different counties eligible to receive their vaccine in St. Clair County? Thanks for all you're doing. I've heard great things about how the fairgrounds is running.
And we appreciate that. And anyone is eligible at this point. So again, if you're out of the county, we will take you. If it becomes an issue later down the line, we may reassess that. But at this point, we're allowing people from other counties.
They have to make an appointment, though.
Yes, you have to have an appointment. So sign up on our vaccine notification form, and the process is the same. And then when you get your link, you can come in with your QR code.
And we would encourage all of the counties around us to do the same, to be welcoming to
Right.
other residents. This really is a regional. We're here. We are in Region 4. That's why we want to help out as many people as possible, and
Right.
so we're leaving this open, and we encourage our surrounding counties to do the same thing.
Okay. The next person says, do I need to resubmit my form once my age group is announced as eligible, or will the form I submitted in January remain active?
The form you submit in January will remain active. We have those broke out by the different tiers, so we have all that information right now.
Okay. Next person says, how many people in the 65 plus category have signed up for the vaccine, and will the essential workers in 1B be the next category we go to?
Okay. So as of right now, say we have around 3,000 left on our 65 and above group. But again, people sign up every day and still back to the 1A group. So as we receive more vaccine in the county, like I said, we'll be breaking those other 1B groups down into smaller groups and doing specialized clinics. And then once we get a good flow of vaccine in the community, then we would open it to the whole 1B population.
Okay. Next person says, please discuss the challenges and complexities with administering a second vaccine to everyone that has received a first.
Well, the way it is now, the state is telling us not to hold back for our second doses, that they will supply those. So, we're counting that is correct. Like I said, if not, you've received your first dose, you can be longer than the 21 or 28 days, but not shorter. The complexity comes in with individuals who have received their first dose in other states that we don't have record of. But those individuals can contact us, like I said, through the call center or sign up on our vaccine notification form, and then we can route them to whatever provider has the same manufacturer of vaccine as they had for their first dose. So if you had Pfizer for your first, you want Pfizer for your second. Moderna for your first, you want Moderna for your second dose.
Okay. The next person says, if a person receives the first dose of vaccine and then tests positive prior to their second dose, how will that affect them receiving their second dose?
We just ask that you do not come for vaccine while you're on your 10-day isolation period. If you successfully have completed that, then you're eligible for your vaccine.
Okay. The next person says, my wife is on medication that she must not take for 2 weeks before her COVID vaccine, 2 weeks after the vaccine, and then 2 weeks before the second vaccine, and 2 weeks after the second vaccine. That's 8 weeks with no medication. She's not taking her medication now, waiting for an appointment. She is 66 years old, immunocompromised, and stage 3 kidney disease. When and how would I be able to plan for her to be vaccinated?
Well, I would urge you to reach out to your healthcare provider. Anytime you alter your medication schedule, you need to do that in concert with your healthcare provider. Like I said, we're down to around 3,000 people left in the 65 plus range, so we would anticipate that she would receive information on appointments within the week.
Okay. The next person asks, I'm curious about how the county receives vaccinations. In general, does the county receive a batch every week, every day, or is it random? Does the county receive all the doses, or do they receive everything and have to or do they have to divide those to those that are administered by the hospitals?
So the county gets a weekly allocation, but what day of the week varies. It's dependent on when the state sends that to us. And then once we see the allocation, it is then direct shipped to the provider directly, whether that be the hospital or the health department. But then the shipping day can also vary by week. So you could technically get it longer than a 7-day period where you're not receiving vaccine. So those days vary by week.
The next person says, why are those who are 65 and older considered a priority when most of them are not working? While frontline workers are being pushed farther and farther down the line, shouldn't those who exposed every work be the priority, not those who are no longer working?
So I think we addressed this earlier, but again, we're looking at those groups with the highest mortality rate, and those that are the most medically fragile within the 1B group.
Next person says, how early should you arrive prior to your scheduled appointment time?
So our appointments start at the fairgrounds at 8 a.m., and I suspect you're asking specifically about the fairground location. We open the gates at 7:30 a.m. We ask that you don't block those gates prior to that time because we don't want to have any issues with accidents right there on that busy road. As your appointments through the day, I would say within 30 minutes of your appointment time. We've not had any backups as far as the traffic flow there. The most I think it's taken anybody to get through would be 50 minutes or less, and that would probably be on a 30-minute observation time at the end. So depending on your history of allergic reaction to vaccine, you'll either be asked at the end to wait either 15 minutes or 30 minutes for observation to make sure that you're not having a reaction. But typically people are through the line to that observation within 15 to 20 minutes.
Okay. The next person says, I signed up my husband and myself very early. At the time he was 64, but he has now turned 65. Is the form being monitored for things like this? Because I don't recall getting a confirmation that my form was accepted. Is there a way to check to see if he's on the list as now being 65?
So the way we ask the question on our alert notification form is we ask for date of birth, and that's for that specific reason, so that if somebody has a birthday and changes age, that we can account for that. When you submitted it, it should have said, answers submitted or responses submitted. If you did not get that, then go back and re-register on the form.
Okay. Next person says, have the emails been sent out for next week's shots? And if not, when will they go out?
So we currently have clinics scheduled through Tuesday, and there will be an hour change at the Fairgrounds Clinic this week. So it was running Monday through Saturday with Sunday off. Starting tomorrow on Monday, we'll have appointments on Monday and Tuesday. We'll be closed Wednesday, then open Thursday, Friday, Saturday, and Sunday. And that will be the schedule from here on out. They did that to accommodate weekend schedules for individuals.
Okay. The next person says, I've been signed up for the COVID vaccine for several weeks now. I am 72, have diabetes and high blood pressure. How much longer before I get an appointment? And we kind of touched on
Yeah.
this.
I would expect within, the next 7-day period, as we receive vaccine, that we will address the rest of those in the 65-plus age category, if not prior to then.
Okay, now we have a few non-vaccine related questions.
Okay.
This next person says, is there any way to answer through contact tracing where the most or at least an average number of the new cases are coming from? Is it family, social gatherings, retail shopping?
Well, I will say on IDPH's website, they have a breakdown of exposure locations, and those are places that people visited prior to finding out their test status. However, when speaking with the contact tracers, overwhelmingly it is from family. That you were at an event with your family or had family and friends over, and then that's how the exposure happened.
Okay, the next person says, if I already had COVID, but someone now in my house gets it, do I still need to quarantine? And can I expose others if I'm around them and then out in the public?
So if you've had COVID within 90 days, either based on symptom onset or test date, you do not need to quarantine if you have a new exposure. However, if you would develop symptoms, we recommend that you see your healthcare provider because while rare, it is not impossible that you would contract it a second time. People can always be a vector for disease, so that is why we say continue to wash your hands, wear your mask, and stay socially distant.
Okay. The next person said, was the UK or any other variant of the more infectious variants identified in our county?
Not county level, no. There have been some in the state.
Okay. And the last question they had today was, why are students allowed to be in public schools without wearing a mask?
They should be masking. If you have a concern, I would direct you back to your school officials or your school board.
Thank you, Milo.
And that was the Mila Show. A few things,
Good job, Milo.
Thanks.
testing, we can't keep talking about that. You have to keep getting tested. We want to keep our foot on the gas on that. Late last night, we were notified that we were chosen for a FEMA program. Mila, can you kind of give us a little update on that?
Right, so we will be receiving a disaster team from FEMA, and it'll be a team of 8 individuals that we will share with Eastside Health District. We hope to utilize those individuals to expand our call center capacity. Right now, we're running Monday through Friday from 9 to 3, but as the fairgrounds will be open over the weekend, we need to be able to accommodate people for cancellations. Right now, if you cancel, it's 233-7703. And then for the signups for the help, it's 825-4447. So again, we want to expand that capacity. We haven't been able to keep up with demand with what we have right now. So those individuals will be utilized for that purpose as well as to promote our busing system. So we obviously have the drive-through option at our fairground location. We also have an option for individuals who do not have vehicles, and they can be picked up at the Shield Street location. If you have an appointment, you can go there and be bused to the fairgrounds to receive your vaccine. And to date, no one has opted for that consideration. So we want to get the word out about that. We hope that this team will be able to assist us in that and to get the underserved populations addressed. So we look forward to having them. I believe they come in on Tuesday, and we'll be collaborating and moving forward.
So not only do we have the largest drive-through site in the state, but it's my understanding 3 FEMA teams are coming to Illinois, of which 2 are in Chicago.
Right.
And 1 is coming to the St. Clair County Health Department and to the fairgrounds. So
We were actually
and
the
to
only-
Eastside Health.
Actually, we were the only state that actually had 3 teams get assigned to them.
That's correct.
So we feel fortunate that that's happening. And I was on the phone call last night, and first thing Mila said, "Are you bringing vaccine with you?" And they said, "Well, no, but we hope that good things will follow because that's what we need is more vaccine because we want to get needles in everybody's arm that wants it." And don't forget to sign up on the portals of the EMA or the health department site or the county. We've got 69,847 individuals that has utilized that we're drawing from. So if you haven't, please do so. That's the way to get the process started, showing your interest in getting the vaccine, and then you will get that notification. Numbers, as the chairman said, going in the right direction. Super Bowl's on tonight, everybody. Just remember, wear your mask, wash your hands, watch your social distancing, and we'll keep these numbers going in the right direction.
And I will say that with this implementation of the new, the fairgrounds and the drive-through, it is the beginning and the end in COVID in a small way.
Yes, that light is getting brighter, and my light, just got to say, while you're sitting here, I know you're, every day, you're down there, Sam, and the entire operation, the feedback that we're getting at the call center through the social media has just been overwhelming of the job, the compliments, and I think that's a tribute to the operation that you've all got set up down there. So we're going to keep it going because we want to get this put behind us.
And, a big shout out to all the health department staff, all the Illinois National Guard, all the contract staffing that we have there providing the vaccine, our team back at the health department who are fielding calls every day and helping with appointments. Everybody is working together and everybody is happy and optimistic, and that reflects with the clients that we see, and the clients are happy, and that reflects back to the staff. So it's a community event.
It's Team St. Clair.
That's
and
right.
As we say all the time, for those of you who have been following these briefings for day 331, we appreciate everything you do, getting the word out there. Please hang in there with us. Remember, patience. That's what it's going to take to get us through this. So we'll be back tomorrow for day 332. We'll be back with Cindy in a few moments to translate this into our Spanish communities. So everybody have a good evening.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.
Buenas tardes, hoy tuvimos a Myla del Departamento de Salud que nos informó los nuevos casos del condado, que son 264,863 personas examinadas, con 26,735 casos positivos, con 89 nuevos casos entre la edad de 10 a 80 años, y 238,128 casos negativos, con 425 muertes. Y 25,293 personas han completado la cuarentena requerida de 10 días por el Departamento de Salud. Y los números estatales son 16,636,585 personas examinadas, con 1,146,341 casos positivos, con aumento de 2,060 nuevos casos de ayer, y 19,633 muertes, con 48 nuevas muertes de ayer. Y en los hospitales de St. Clair County hay 88 personas hospitalizadas y 6 personas en ventiladores. Y en la región 4 tenemos a 145 personas hospitalizadas y 8 en ventiladores. Y Mark Kern nos dio los códigos postales con casos positivos, que son 62201, 552 casos, con aumento de 1. 62206, 1224 casos, con aumento de 3. 62207, 551 casos, con aumento de 2. 62208, 1488 casos, con aumento de 4. 62220, 1900 casos, con aumento de 6. 62221, 2568 casos, con aumento de 14. 62223, 1597 casos, con aumento de 3. 62226, 2947 casos, con aumento de 10 casos. 62243, 694 casos, con aumento de 1. 62254, 752 casos, con aumento de 2. 62255, 75 casos, con aumento de 1. 62258, 963 casos, con aumento de 6. 62260, 739 casos, con aumento de 2. 62264, 337 casos, con aumento de 2. 62269, 3023 casos, con aumento de 15. 62282, 61 casos, con aumento de 1. 62285, 520 casos, con aumento de 2. Y en la región 4 estamos al 5.6% y en el condado estamos al 6.3%. Ya tuvimos una sesión de preguntas y la primera pregunta a Mayla del Departamento de Salud fue: ¿por cuánto tiempo es la vacuna del COVID efectiva? Y la respuesta es: hasta ahorita por los estudios son 95%, pero no sabemos si cada año va a tener que vacunarse como lo de la flu. Todavía no hay suficientes estudios. Y la otra pregunta fue si una persona ya tuvo el virus y alguien de su casa sale infectado del virus, si esa persona requiere hacer cuarentena de nuevo. Y la respuesta es que no, al menos de que tenga síntomas. Y la última pregunta es: ¿dónde se puede registrar para cuando la vacuna sea disponible? Y en la página del condado de St. Clair County puede usted meter su información, registrarse, y ya cuando sea su turno ellos lo informarán cuando sea elegible para vacunarse. Y finalmente se le recomienda que todos sigan usando el cubrebocas. Y es todo por hoy. Muchas gracias.